Hello everyone, my name is Oluwafolaji Nabisaya. I'm a member of the 2020 class for the NWAWE 30 Under 30 Award, and I'm also the Managing Director of the Clean City Initiative. The topic of this session, the title of this presentation, is Climate Change, Global Health, and the Role of Environmental Education. At the end of this presentation, I would have explained the relationship between climate change and its effect on global health according to the World Health Organization, and as well as I would have highlighted the role that environmental education has to play if this projected impact of climate change is to be averted. According to the World Health Organization, between 2030 and 2050, climate change is expected to cause approximately 258,000 additional deaths annually from its various effects, including malnutrition, malaria, diarrhea, and heat stress. And the implications of this extend beyond just the effects on health, but also it also has financial and economic implications, having a direct damage cost of between $2 to $4 billion per year by the year 2030. In this image, the various impacts of climate change. The various impacts of climate change on human health are shown, and some of them include an increased burden of respiratory diseases such as asthma, respiratory allergies, an increased burden of cardiovascular diseases as well, such as hypertension, many of which have been linked to the decrease in air quality as a result of increase in industrial effluents that are sent into the atmosphere. Another one would be the increased burden of infectious diseases such as malaria, dengue, encephalitis, Lassa fever, Rift Valley fever, Lyme disease, chikungunya. These are some of the most dangerous diseases, viral diseases known to man today. And the WHO has explained that due to an increase in the ambient air temperature would lead to an increase in the geographical spread of the vectors of these diseases, which will then translate directly as well as indirectly into an increased burden of these infectious diseases. In addition, the extreme heat can cause heat-related illnesses, especially for the elderly who are more prone to many of these heat-related illnesses, such as heat stress and heat stroke as well. Also, the effects on forced migration would lead to an increase in the number of migrants and refugees, which of course would then lead to increase in the number of IDP camps, and in many of these IDP camps the living conditions are very poor, and that would then also lead to an increase in the burden of diseases in the long run. The effects are diverse and they are very interconnected, and more information can be found on the website of the Centers for Disease Control and Prevention. A report in 2018 by the Lancet Commission on Planetary Health actually described climate change as the biggest global health threat known to man as at that time. Well, this could be arguable in the light of the COVID-19 pandemic that the world currently grapples with. But the difference between COVID-19 and climate change is while we know COVID-19 already and are well on our way to securing a vaccine, there can never be a vaccine for climate change. We either prevent it and its effects, or we have to live with them and the devastation that come along with them as well. Now, where does environmental education come in? Well, environmental education comes in helping to build climate resilience, and in two major aspects: in the mitigation of climate change and adaptation. Mitigation primarily talks about any action that is directed to reducing or preventing emission of greenhouse gases that cause climate change, while adaptation refers to actions that help human beings and human settlements and populations to manage the risks and the myriad of consequences that are meant to come from the impact of the climate crisis. Some of these impacts include impacts on water availability, as well as on natural disasters like floods and landslides, earthquakes, and so on. Well, on mitigation, environmental education can help to increase the environmental literacy amongst populations, both vulnerable and non-vulnerable, and this will then increase the increased propensity for adoption of personal mitigation strategies, such as, for example, being vegetarian, which is one of the personal mitigation strategies that is highly advised by the IPCC. as well as being conscious about, being more environmentally conscious about the carbon footprint of our day-to-day activities, deciding whether that vacation trip can best be taken through the train, or does it have to be by flight. These are some of the little decisions that we have to take every day and indirectly contribute to our carbon footprint and our contribution to the climate crisis. And eventually, an increase in environmental literacy would also lead to an increase in advocacy by people who are more informed about the climate crisis, will be more likely to put pressure on their governments to adopt mitigation policies at all levels, policies on establishment of a green economy, policies on carbon taxing, and so on. Now, according to Iberdrola, and also the original source of the data was from the World Bank, these are some of the ways in which environmental education can contribute to mitigation of the climate crisis. Some of them include integration of environmental education into basic and elementary education, would help to increase the environmental literacy, like we earlier mentioned, of young people who we say yes are the future of tomorrow and be responsible for many of the major decisions that will be taken in the coming years. And also, more importantly, help to strengthen the research capacity, particularly at tertiary healthcare level, tertiary education levels, for example, research capacity on various techniques that can be used for carbon capture and for mitigation of some of these greenhouse gas emissions. On adaptation, essentially, environmental education can increase the ability to adapt to the consequences of climate change, for example, by promoting the uptake of water conservation practices, which would help to prevent and mitigate the impacts of water shortages and droughts, and also by promoting prevention practices such as use of insecticide treatment and insecticides, which would then reduce the expected increased burden of infectious diseases, or at least help vulnerable populations to cope with this. Also, by promoting regular water intakes and cooling breaks at homes and workplaces, we can help adapt to the increased temperature and heat stress that would come with climate change. But where do we come in as the Clean City Initiative? The Clean City Initiative is a grassroots sensitization campaign of community members, particularly in underserved rural communities in southwestern Nigeria, where we go into these communities and educate them on the effects of plastic waste pollution and waste burning on the environment, and how it contributes to the climate crisis, as well as indirectly on their health, their lives, and livelihoods. We essentially help to highlight the major adaptation and mitigation steps community members can take to contribute directly to reducing the threat of climate change on the environment and in the long run on their health. Over the last 2 years, about 96% of community members that we have worked with have reported an increase in their knowledge about improper plastic waste disposal and its contribution to the climate crisis, as well as its deleterious effects on their health, life, and livelihoods. And in conclusion, if we are to prevent this astronomical numbers of 250 deaths per annum from the climate crisis, if we are to prevent this from happening, if we are to prevent a repeat of the shocking numbers that we see from the COVID-19 pandemic, well, the time to act is now. And environmental education will certainly play an influential role in helping us get to the less than 1.5 degrees Celsius temperature rise target, both pre-industrial levels, as advised by the United Nations and the IPC. Thank you very much for listening, and I'll welcome questions and answers at this time. Thank you.